If you've been told you've got a disc bulge, then the first thought that probably went through your head is, do I need surgery? But the good news is 99% of people with a disc injury don't actually end up needing surgery. But what does matter is how you support your recovery, because we know discs can and will heal with time. But did you know exercise actually speeds up the rate in which discs heal? And as a physio, I'm going to show you which exercises you should be focusing on to help heal your discs and ultimately help to reduce back pain. Now, it's important to recognize that there are 4 key movements that you are going to be focusing on: spinal flexion, extension, lateral flexion, and rotation. Now, all of these movements put pressure on your discs, but in a good way. Most people, however, assume that just because they feel pain during these movements, that it's making the damage in their discs worse. But this couldn't be further from the truth. What you need to understand is that movements within these planes actually help restore your disc's shape. It just takes a long time because the disc heals very slowly. All we have to do is tailor the movement based on your pain response. So in this video, I'm going to give you an easier, moderate, and harder variation on the exercises, which then allows you to pick an exercise based on how your pain feels. I will, however, say that some discomfort is expected, but it shouldn't be severe. So if you manage the easier variation on the exercises relatively pain-free, then start there and progress it based on your pain response. So without waiting any longer, let me show you the exercises. Now, the first movement we're going to focus on is prone extension. So for this, you're going to lie yourself down on the floor or on your bed, face down. Have your forearms out to the side, bring your nose down towards the floor or the surface, and then from that position, just arch and lift your chest away from the surface. Hold it for a second or two, and then lower yourself back down. Now your forearms are down to control the movement and to help offload your lower back, and only go as far as you can tolerate. You should feel a little bit of pressure in your lower back. Completely normal. And just with this, remember to breathe. Just find a breathing pattern which works well for you, because we want everything to relax. I'm going to work up to 8 repetitions, have a rest for around 30 seconds, and then repeat another 2 to 3 sets of 8. So that's the easier variation. To make this a little bit more difficult, in the moderate variation, we can perform the same movement but rely less on our arms. Now, I'm going to perform the moderate variation in standing. To do that, I'm just going to turn to the side so you can see me. All I'm going to do from there is place my hands on my hips and then just lean myself back as far as I feel comfortable and then back to neutral. Okay, so again, lowering yourself back just from the lower back. You're not trying to push your pelvis forward. The movement's purely isolated in your lumbar region, which is your lower part of your spine. And again, find a breathing pattern which works well for you. Perform it slowly. Only go as far as you can tolerate. In this position, my lower back's having to work harder as I'm standing, fighting a bit more through gravity. Once you've done around 8 repetitions, repeat that 2 to 3 times over with a good bit of rest between. And then if that doesn't feel hard enough, you can move on to the more advanced variation. For an even harder variation on this extension, we're going to go back down to the floor, lay ourselves down on our front. From here, I'm going to cross my hands on top of each other, and then I'm gently just going to start pulsing and lifting my chest off the floor. What you will notice is that I can't lift my chest as far. That's completely normal. My lower back muscles have to work extremely hard to perform this action. I'm breathing as I do it, but for this, you want to be breathing very comfortably. Try not to talk. And again, just perform up to 8 repetitions in total, 2 to 3 sets. That's your lot. Next, we're on to flexion of the lumbar spine. And to start off nice and easy, I'm just going to perform this one sitting. So this is the easier variation. Have your knees at about hip width apart, hands on your thighs. And in that position, you're going to sit up tall and then gently lean yourself forward. So we're going as far as we feel comfortable in this forward movement. And then using your hands on your thighs, you're basically helping to guide yourself forward and then to bring yourself back up into sitting. Again, find a breathing pattern which works well for you. Go slowly with this. Feel like with each breath, you're able to take your chest a little bit further towards the floor. Don't worry too much if you're slouching slightly. When it comes to healing discs, posture really does change from person to person. Perfect. So you're going to work up to 12 repetitions on this. And again, repeat 2 to 3 times over with a little bit of rest between each set. And if that still feels quite easy, you can move on to the moderate variation. So for the moderate variation on this flexion movement, you just need to lean yourself up against the wall, have your feet out in front of you, about a foot away from the wall, feet again around hip width apart, and just a slight bend in your knees. And from there, hands on your thighs, you're going to lean yourself forward again. Only go as far as you feel comfortable and then lean yourself back. Just remember to have your pelvis resting up against the wall. Your back has to come away, but with your pelvis intact against the wall, it just offloads your spine a little bit more. I'm trying to use my hands a little bit less compared to when I was doing it sitting, but still they're helping to guide me down and push me up a little bit if needed. Now for this, just work up to 8 repetitions, 2 to 3 sets in total is enough. And try and find, if you're able just to go a little bit deeper on each of those repetitions, that's great. And again, don't worry too much if you start slouching. I'm not going to tell you off. And if that still feels quite easy, you can move on to the harder variation on this flexion movement. So the harder variation on the flexion movement is a deadlift, which does scare a lot of people as it's a pretty complex movement, but we can teach it nice and simply. A deadlift basically means you're picking up a dead weight from the floor, and that's it. It's very similar to a squat as well. So to perform a deadlift, have a weight on the floor. In my case, I'm using a kettlebell, but you could use anything at home. You could even use a water bottle. From that position, you're just going to approach it. I'm going to stand side on so you can see what I'm doing with my spine. I'm having it so it's in between my feet and my toes are generally in line with the item. Have your feet about hip width apart. Now, to pick it up, you're not just going to bend over, reach for it and stand up. We're going to make it a little bit easier on our lower back by bending our knees and sticking our butt back. Now, I want you to have your arms out in front of you. Let them flop. That floppiness position is what you should feel. The arms shouldn't feel really tense. So stick your butt back, bend your knees, reach for whatever you're picking up. Pick it up, stand up and hold that position and then reverse it. Stick your butt out, bend your knees, allow the weight to drop, and then reverse it again, stand up. Now just make sure with this, your arms are nice and floppy. Your arms aren't doing this out in front of you, putting more strain on your upper back. And again, we're not bringing it up towards our chest, although that's completely fine as an exercise. For you, you're just doing a deadlift. So you should feel this a little bit more in your legs, as well as your lower back. But for this, I just want you to work up to 8 repetitions, 2 to 3 sets in total. It's completely fine. And just choose a weight that you feel comfortable with. And that's pretty much it for flexion. Next, I'm going to show you lateral flexion. So next, we're on to lateral flexion, which is that bending sideways movement. And the easier variation is a seated lateral flexion position. So you're going to sit yourself down on a chair, which you find comfortable. It helps to have no arms on the side of the chair, but don't worry if you have it. All you're going to do from there is just relax your arms down by your side. And then from there, just lean down one way, come back up, and then lean the other way. It's not rocket science. Of course, it might be a little bit painful for you. So again, only go as far as you feel comfortable. But for this, it really does help to exhale as you lower yourself down to the side. Because if your diaphragm is contracting and your lungs are really full with air, it does limit how much movement you have. So breath in on the way up, breathe out on the way down. Breath in on the way up, breathe out on the way down. All right, so that's it. Aim for 10 repetitions each way, 2 to 3 sets in total. And if it's still easy, move on to the moderate variation. Now for the moderate variation, you're going to perform this down in lying, either on the floor or on your bed. Take a position where your knees are bent, your back's nice and flat against the floor or the surface you're on. Ideally without a pillow, but you can have one for your neck if needed. All I want you to do from there is just bring your hand over towards the outside of your foot. And then you come back up and then repeat on the other side. So you should feel this a little bit more in your abdominals or your obliques, which are the muscles that sit on your side, as they're having to work a little bit harder through resistance. Again, breathe as you perform this. Ideally, just work up to 10 repetitions in total on both sides. 2 to 3 sets with this is completely fine with a bit of rest between. But again, if that's still feeling quite easy, I'll show you the harder variation on the lateral flexion. So the harder variation on the lateral flexion is just to hold a weight down by your side as you're standing up. Have the other hand anchored to your hip. From there, just allow the weight to drop towards the floor. Feel it go as far as it can go and then come back up just to neutral, okay? Again, dropping the weight down by your side and then back up to neutral. So you're going to repeat 6 to 8 repetitions on one side, and then you'll switch sides and perform it on the other side. In my case, I'm using a kettlebell, which is 10 kg, but you could use anything at home. You could even fill up a plastic bag and just pull a few items in there. And that's pretty much it for lateral flexion. Next, I just need to show you rotation. Now we're on the last movement, which is rotation, which is my favorite because it always seems to be overlooked in the rehab process. And to perform an easier variation on the rotation, again, it's going to lie yourself down on the bed or on the floor. Take position with your knees bent. And from there, have your hands down by your side and just allow your legs to roll one way and then roll them the other way. And it's as simple as that. Leg drops, basically. Again, only go as far as you can tolerate. If it is uncomfortable, just stop a bit earlier on. And trying to relax your breathing as you perform this can really do you wonders. For this, you could do up to 10 repetitions on both sides. Repeat that 2 to 3 times over, and then stop if you need to. And if that still feels quite easy, let me show you the moderate variation. So moderate variation on the rotation movement, you're just going to sit yourself down in a chair, have your hands across your chest, and then all you do from there is just rotate your spine as far as you can go one way, and then back to neutral, and then just go the other way. Now, as you're sitting up, your spine is having to work a little bit harder against gravity. There's a little bit more of what we call axial load, so more load going through your spine, which is very good to help recover disc injuries. But again, just like the ones with the leg rolls, the easier variation, you're only going as far as you can tolerate. And just notice how I pause at the middle, so I don't go all the way through range. I just reset myself. And it allows me to also work with my breathing. And I'm not too fussed about how you breathe. I just rather you find a comfortable breathing pattern. And for this, again, 10 repetitions both ways is absolutely fine. 2 to 3 sets in total, again, works really well. All right. So if that's still easy, I'll show you the harder variation on the rotation movement, which is the last exercise in this video. Now for the harder variation on the rotation movement, I'm just going to use a resistance band, which you can also use. Anchor the resistance band against something which is nice and sturdy. So you can use a door handle, but I'm just using this weight stack. Tie it up. And from that position, you're just going to stand front on with the arms out in front of you, band anchored to the side, and then you're just going to perform a little bit of a resisted rotation to one way, and then just back to neutral, okay? So I'm really performing this with good controlled technique. I'm not rushing the movement. I'm not letting the band take control of the action. So I'm controlling it as I take it through range. And just imagine you've got a rod going through the top of your head. It's purely a rotation movement. I'm not bending and twisting my trunk to the side. And for this, 6 to 8 repetitions works well to start with. And I would say just increase the resistance over time, as well as the repetition range if you want to. And then once you've done 6 to 8 repetitions, then you just face the other way and perform it on the other side. 2 to 3 sets finally works really well for this. And that's it. And don't panic if it takes time. Discs will heal. And you might be someone with lower back pain, but you also might be someone with hip pain or hip bursitis. And if you want to know ways to improve that using exercise, then you can check out this video here and I'll tell you. And if you enjoyed this video, don't forget to like and subscribe.